Do you know the older you get, the higher your chances of getting prostate cancer? In today's video, I'm going to tell you what are the risks, common signs and symptoms, and how do doctors diagnose and treat prostate cancer. Welcome to another episode of Doctor Says. As mentioned earlier, age is one of the biggest risk factors for prostate cancer. This disease rarely affects young men before the age of 40, but the incidence rises rapidly thereafter. As you can see, the incidence is up to 70% of men between age 61 to 70 years. According to the American Cancer Society, in the United States, Asian American and Latino men have the lowest incidence of prostate cancer. In contrast, African American men are more likely to develop this disease than men of other ethnicities. In some cases, prostate cancer is inherited. Approximately 5 to 10% of prostate cancer are caused by inherited mutations. And lastly, diet factors. I've previously made a video dedicated entirely on what foods to eat and what foods to avoid to reduce the risk of prostate cancer. If you are interested, the link will be in the top right corner. Now, moving on to the symptoms. Symptoms of prostate cancer can include urinary problems, sexual problems, or pain and numbness. Urinary problems can include frequent need to urinate, a stream that's slower than normal, or blood in the urine. Sexual symptoms include erectile dysfunction. Also known as impotence, this condition makes you unable to get and keep an erection. And lastly, around 6% of patients who had prostate cancer are metastatic at the time of diagnosis, meaning the cancer had already spread to other areas of the body. Prostate cancer often spreads to the bones. This can cause pain in the pelvis, lower back, or chest. If the cancer spreads to the spinal cord, one may feel numbness or lose the feelings on the legs and bladder, causing urinary incontinence. Every patient who are suspected of having prostate cancer should undergo a test known as digital rectal examination. In this exam, your doctor will insert a gloved finger into your rectum to inspect your prostate. We can often feel if there are any hard lumps on your prostate gland that could be tumors. Next, your physician will order a blood test known as the prostate-specific antigen or PSA test. It is a protein produced by the prostate, and a high level may be indicative of prostate cancer. To confirm the diagnosis, a biopsy of the prostate is required. A piece of your prostate will be removed for examination. A transrectal biopsy is typically performed with the guidance of an ultrasound or MRI. Now, for the treatment, it varies from individual to individual as not all treatment is standardized and no one treatment suits all. Depending on the stage of the cancer, the treatment options may vary, which includes surgery, radiation, chemotherapy, hormone therapy, or brachytherapy, which is a procedure that involves placing radioactive material inside your prostate, sometimes also known as internal radiation. So there you have it, guys. This is all you need to know about prostate cancer. Appreciate if you could hit that little thumbs up. Don't forget to share and subscribe, and I will see you next week.